PectaSol is modified citrus pectin. Citrus pectin is that little white stuff you peel off the outside of your orange or tangerine or whatever that you don't eat. That's pectin. They take that out of the citrus and they hydrolyze it and they process it to make it into the teeny tiny dissolvable 40 to 65 kilodalton size. So very, very small size particles that are super absorbable. And your body will absorb that, goes out through your bloodstream, whereas the regular pectin will just stay in your gut. And that's not a bad thing. They actually use citrus pectin as a binder, like you can in bentonite clay or zeolites or humic fulvic acid, charcoal. Those are all binders as well in a certain situation. But this particular product has been shown in over 75 published studies that deliver broad spectrum benefits for the most critical areas of health, from cellular regulation to immune response, cardiovascular, kidney function, and more. And if you take this more frequently, it's been shown to help with energy, mental clarity, immune function, reduce stiffness, mobility, improvements in detoxification, cellular function, and general well-being. How does it work? It enters through the GI tract. It binds, blocks active protein in the body called galectin-3. It's associated with heart function and closely associated with renal kidney function. It is a type of a marker of inflammation. It is a key regulatory part of the entire inflammatory cascade. Too much galectin in your body will act as sort of a biofilm around the individual cells, and almost like it layers around the cells and blocks the little signaling phospholipid antenna that are in the phospholipid bilayer of the cell. So galectin actually blocks cell-to-cell signaling, proper immune functioning, cell-to-cell communication for protein and enzyme synthesis. And what this modified citrus pectin does is it unravels, or it takes off that layer. It blocks the blocking of the cellular galectin layering that happens around it. It's very researched, especially in people that have high or excess galectin, but even in people who have, quote, normal levels, it still can help with them as a maintenance product because, as I just mentioned, galectin-3 is an inflammatory marker. So like a SET rate or even a white blood cell count, those numbers can go up and then go back down, and go up and go back down, almost like your temperature on a thermometer. You want a temperature, but you don't want a fever all the time. Well, you have galectin, but you don't want it to be up, and you don't know necessarily when it's going to be up because you're not measuring it all the time. But PectaSol, it balances inflammation, immune response, cellular behavior because of the cell-to-cell communication, allowing that to happen, and neurologic wellness, and more. It's been clinically proven to bind and eliminate heavy metals, including lead, mercury, arsenic from the circulation, safely without any disruption of any of the essential micronutrients in your body. So you can quickly see that this is a base type of a controlling thing that can be used in a lot of different types of patients that are having any sort of autoimmune, chronic disease state, chronic infection, anybody that has a chronic inflammatory process, and cancer. It isn't a cure for any of those things, but it's to help regulate or modulate the inflammatory cascade in that disease state. This isn't just, someone else selling vitamins. They've spent 25 years studying this product and doing the studies to show how it works, and now you have it available here. There are other modified citrus pectins on the market, but do they have the data to show that it's at the size where it can get down to the cellular level and do the things to heal it up? It's available in powder, a couple flavors, small, big, and capsule size. So it is expensive, but if they go try to buy it online, it is more expensive. So very, very specifically have priced this even below what the auto ship best deal you can get from the manufacturer price is, because it is extensive, and I want people to be able to, as best as we can, make it available to anybody. The capsules are more expensive, I tell you, but people sometimes don't want to do this gradiness that goes with it, so that is an option. And there is chewables. Those are even more expensive. The regular dosing for most people is going to start like a half a scoop daily, and then go up to a half a scoop twice a day, and then 1 scoop twice a day, and then in some situations, it might go up 2 or 3 scoops twice a day. I'm guessing this is probably, depending on how they use it, it's probably a couple months supply.